Okay, thank you, everybody. I am very glad to be joined by Senators Leahy and Murray and Schatz. And first, sorry we're a little late. We spent about 45 minutes with the Vice President and his team from CDC and FDA and HHS. They were generous. They answered a lot of questions, 45 minutes of straight Q&A, and so that was very good of them. The problem is they didn't have as many answers as we needed. They didn't have the answers we needed. The biggest question, testing. When and where? They could not answer how soon people would be able to get the tests. We need an on-site test, not a test that has to be sent far away and sent back. And we need to know where people can get it, how people can get it, and we need to make sure it's not so costly that people don't get it. And there were no answers to those vital questions. We hope we will have answers from them soon, but that is a real problem. Second, I would say this. We are making good progress on the legislation that Senator Leahy and Senator Murray and Senator Schatz are all working on. And the Democrats and Republicans in House and Senate are the adults in the room. While the President spends all his time spreading misinformation, downplaying the significance, blaming people, even latching on to conspiracy theories, it is good that Democrats and Republicans in the House and Senate are working together very quickly, and we all believe that we will have a bill passed and on the President's desk by the end of this week. The number will be much closer to the one that I had and our caucus had suggested, $8.5 billion, than the $2.5 billion that the President suggested, which had been way too little. It will provide a lot of funding to the localities, the community health centers that need the help. It will provide funding so that we can get equipment such as masks and ventilators to the communities. It will provide funding so that we can have a vaccine. We believe that the vaccine should be very cost-effective and not be out of the reach of average folks. And that's one of the arguments that's still being disputed, how much the vaccine should cost, particularly, as Senator Leahy reminds us, since a lot of the research is being funded and helped by federal agencies. We're working together in our states with public health officials to make sure that they get as much information and resources that they need. We are also making sure that as much information as available gets to our local folks. So, while the Trump administration's response has been too slow and halting, Congress is taking swift action. And we would plead with the President to start showing some leadership, to start acting like a leader, like the adult we need, serious, sober, and credible, not going to rallies and blaming people. When you make a legitimate criticism, that's our function. And for the President to act correctly, he would take those criticisms seriously and deal with them. We hope that will happen. The American people need the truth. When an administration loses its credibility, nothing but fear takes over. Senator Leahy.
Thank you, Leader. And I also appreciate the briefing we just got. I've been here long enough to remember when the Senate would show its conscience and come together. This, I believe, is one of those times. It's one of those issues involving a great deal of money, a great deal of concerns, and I see Republicans and Democrats working very closely with each other. Senator Shelby and I have tried to inspire that in the Appropriations Committee, but we've also had the support of Senator Murray, Senator Schumer, and others, and our counterparts in the House. We are very close to appropriations. I would urge, and I believe it could be done certainly by Friday evening, have a bill that has gone through both bodies and be on the President's desk. It should be. We need the funding for this. We need to repay some of the accounts that we've had to borrow money from, like Leahy, but we need to have the funding, and we need to have the American people see we're working together. This is as serious a thing as everybody thinks it is. It is not a place for partisanship. It's a place for us to be Americans, and it's a place for the Senate to show its conscience.
Senator Murray, whose state has been the epicenter of the coronavirus crisis.
Well, thank you. As this coronavirus continues to spread, people across the country are looking for answers, they're looking for action, and they're looking for reassurance that we are prepared for this. Unfortunately, the administration's response so far has not inspired confidence, quite the opposite. Just as we are standing here, I just was texted that 2 more people have been confirmed fatalities in King County and Washington State, just while we're standing here. The failure to develop and distribute working test kits to public health agencies has really cost us valuable time. I am hearing from people personally across our state who are frustrated. They believe they have been exposed, they are sick, they want to get tested, they have nowhere to go. Even when people can get tested, which has been very few so far, the results are not coming back as fast as we are being told they are supposed to by administration officials. I've been in constant contact with our local health officials, with the federal officials here in Washington, D.C., with our state and local officials on the front lines of this crisis back home in my state. And it's very clear from those conversations, the most important thing we can do right now is pass a strong emergency supplemental as quickly as possible so that our federal and state and local health officials have all of the resources they need. This is truly a serious crisis, and we cannot respond on the cheap or at the last minute. I was particularly frustrated by the Trump administration, who took a very long time to send us the emergency supplemental request. We literally had to send a letter to them asking them to do this. They waited till it was clear we were seeing new cases of community transmission, and it was totally inadequate when we got it. I am very pleased that here in Congress, as Senator Leahy said, Democrats and Republicans were quick to make clear that that was not adequate, and we are working right now to negotiate a robust emergency supplemental that will treat this situation as it is, a crisis, and provide the resources we need. I am focused on boosting support for our state and local health departments so they can scale up to respond to this, to provide stronger protections for our healthcare workers so they can respond to the virus without getting sick themselves and spreading it even beyond where it is, making sure state and local health departments are reimbursed for their efforts, and investing in prevention and response internationally and in research and development for vaccine and treatments, which we will have to keep saying it has to be affordable, or the people who need it the most, who are spreading it, will not get it. Democrats have made very clear that this new funding that is dedicated to the coronavirus outbreak cannot be stolen for other programs or political projects. Families and communities are already grappling with the disease spread of this, and we urgently need to focus on people who can't take a day off from work without losing a paycheck, or don't have affordable child care if a school closes, or who do not have health insurance, who are experiencing homelessness. We know there are not enough tests out there right now. People cannot get access to them. What people in my state are being told is stay home for 2 weeks. Imagine if you are a low-income worker or your boss says you can't stay home, what is happening in our communities. People want to be safe and protected. They do not want to spread this. They want to take care of themselves, but we don't have the capability right now to do it with the policies we have in place. And I haven't even mentioned homelessness, which the mayor of Seattle told me she is extremely worried about that population as well. So we don't have time for partisan politics here. I'm encouraged by the bipartisan work that is happening here in Congress, but we do not need any more downplaying, fear-mongering, calling Democrats fear-mongers, or having the Mick Mulvaney tell all of us not to watch television. People need facts. They need to know what to do. These tests need to be developed. Parents, families, communities, business leaders need to know when exactly they're going to get this testing and what to do so they can respond effectively. That's why we're working here in Congress and why we need this administration to be absolutely at the epicenter of this with an ability for all of us to trust them, not mistrust them.
Senator Schatz.
Well, Senator Murray captured the situation accurately. I'll just add a couple of things. The state and county and local governments are on the front lines of this. And so the federal government has two essential roles. One is communication and coordination. And that's not just about interagency cooperation. That's not just about keeping our state and locals informed, although that is an essential aspect of this that has been lacking. It's also about the ability to convey adverse information, to convey negative information, and have the administration receive negative information and not treat it as though it is a partisan attack. When we report a lack of beds, when we report anxiety, when we report a lack of masks, when we report that despite the happy talk of the administration that test kits are not in fact available to the extent that it is being talked about, that is because we all care about the safety of our communities. This is not a partisan attack to say that the administration has been not coordinated in their response. And so one of the things that this administration has to settle into is this idea that we're going to convey negative information to them, both privately and publicly, and that will help them in their response. This is not designed to hurt them in their response. And the second thing that the federal government ought to do is fund the state and local governments who are already on the front line and already incurring costs. I'm hopeful that the supplemental will do that, but it may not be enough, and we may have to look at the hard costs that especially state and local governments are incurring and look at an additional appropriation in the future.
Questions?
Senator Schumer,
Yes.
do you think any economic stimulus is needed in light of the virus?
Well, the first focus ought to be getting the money to the localities, getting the tests to the localities, coming up with a better test. We ought to concentrate first and foremost on the safety and health of our people, not on the stock market. There's going to be a meeting tomorrow to discuss how to affect all the people who visit the Senate, all the people who work in the Senate, and the House as well, in the whole Congress.
It's not just the stock market, the Federal Reserve cut rates today. So are you worried about the economic impact that coronavirus has?
Look, again, we certainly want to look at that, but job number one is the health and safety of people. The best way to have economic security is deal with this as effectively as possible.
Senator Schumer, what assurances are you looking for on vaccine costs, and would that be part of any funding?
We want to make sure, we want to make sure that it either, with the vaccine, that no one, whatever their income, avoids getting the vaccine because they can't afford it or because they're being asked too high a fee.
Same goes for testing.
Same
goes
with
for
testing, exactly. Yes.
Can I add to
Go ahead,
last one?
go ahead.
If I could just add to the last thing you said. We have, in our discussions of Appropriations Committee, we've talked about the fact that millions and millions of dollars, possibly even hundreds of millions of dollars of taxpayers' money is going to go into developing vaccine and test kits. We are not then going to say the companies, after we taxpayers have paid for all this, now go out and make a huge profit on it. That's not going to happen.
And that's one of the disputes. Wait, stop. That's one of the disputes that is holding up the bill right now. Our Republican friends don't want to see the kinds of limitations that we want to see based on what Senator Leahy and I said. Yes.
Senator Murray, is your state prepared for an expansion of this outbreak, and are you getting the coordination with the support from the federal government that you need beyond funding for your state?
The number one thing I am hearing from personal family members who are sick, to community leaders, to businesses who are trying to make decisions, to local school districts who are trying to decide whether to keep their school open today or not, is we need facts. And the most important way to have that is to have tests available for everyone, because if you know you're sick, stay home. But right now, it's if you're sick, just stay home. And that is having a really huge impact. So the number one concern is that. Secondly, to have the proper equipment and supplies, which hopefully the supplemental will help. I'm talking about first responders, healthcare officials. We now have a fire department that has 15 members of the fire department who are on quarantine for 2 weeks because they responded to the crisis that you're hearing about. I mean, the impact is real. We need masks for our healthcare facilities, we need ventilators, we need equipment, and we need it fast, and so will every other state.
How is the state on masks right now?
The CDC has given us some of the stockpile, but it is not yet enough.
And there's money in the bill, I think about $900 million for those kinds of things, masks, ventilators, and other kinds of equipment that will be needed as we go. Last question.
Senator Schumer, I've heard that the Senate stationery store, et cetera, is restocking masks and is being sold out of masks, whereas people who are healthy are not supposed to be wearing masks. So what kind of guidance?
Well, we need some guidance from the authorities. I'm not the medical authority. I would like to see guidance from them, not just here for the Senate. I'm not familiar with that, but for the whole country. Thank you, everybody.